this is also related, trying to tie everything in, is related to that fight or flight. Look at his neck. He's ready for a fight. You know, this is your most vulnerable area, so as soon as stress comes, you got to get down and protect the neck, right? Hunch those shoulders up. And what do you think I see 60% of the day? I have pain here, doc, and pain up here. You know, it's that old fight or flight mechanism. So I can release those tissues and have them feeling great going out of the office, but it's empowering them then, what are they doing at home the rest of the time to correct the old fight or flight mechanisms, the stress, the posture at home, okay? So next slide, please. So this heavily interrelates with trigger points. We've all felt trigger points in our shoulders, those little knots, right? You've all felt a knot in your shoulder or your neck or your back. Well, the interesting thing is, and I'll keep this real simple, it's tying in now through studies to acupuncture meridian points, through Yanda's upper cross and lower cross, and they're finding that they're actually they're finding that the body's muscles and the sheath that covers them, the fascia, are actually like energy superconductors. They carry an electrical capacity. They've already mapped it out. So you can imagine if you have fascial trigger point restrictions, it's affecting your energy flow or your electrical capacity from a physiologic basis. So what's really interesting, this guy came along, his name was Thomas Meyer. He wrote a book 4 years ago called Anatomy Trains. He basically mapped out that there are fascial trains, connective tissue trains that start at the foot and go all the way up. So I wrote, just as a joke, the head bone is actually connected to the foot bone. So it is all connected. I've watched a demonstration one of my mentors gave. Someone did forward flexion and they got to here. And then he used some soft tissue release only on the arch of their foot and their posterior ankle. And after 5 minutes of treatment, they were touching their toes. So they